see. Jolene, are we recording? Are we good?
Yep, just push record. Thanks for checking.
Yeah, definitely. Perfect. Well, welcome everyone. Thanks for jumping in on a Friday. We're excited that everyone is here. My name is Mary Young, and I am the community liaison in Austin, Texas at SonderMind. And we're thrilled to have our episode 5 of SonderMind's webinar series called Going There. During today's web series, we will be learning about different ways we can support youth in the LGBTQIA+ community and improve mental health outcomes. We're really excited to support our communities over the next couple of months with these virtual events that are going to cover a wide range of both supportive and interesting topics. So we're really happy that all of you are here today. Just a couple housekeeping items. We'll be muting our guests throughout the performance and the presentation, although I really encourage everyone to use the Q&A section to type questions throughout, and we'll take some time to answer those during as well as at the end. And if there are any questions we missed, we can definitely answer those at the very end. We will be recording today's webinar and sending this to the email you used to register. So if you'd like to post about this webinar in social media, please use the hashtag #GoingThereWithSonderMind. But today we're really honored to have Summer and Sarah with us from Out Youth in Austin, Texas. Out Youth is a nonprofit in Austin that offers youth of all sexual orientations and gender identities a place where they are loved, acknowledged, and accepted for exactly who they are. But I'm going to turn it over to Summer and Sarah.
Thank you so much, Mary, and thanks everybody for being here and taking time out of what I'm sure is a busy week and a busy Friday to learn a little bit about supporting this population that's really near and dear to our hearts. So my name is Sarah. I use she, her, and hers pronouns, and I'm the clinical director of Out Youth. So I oversee all of our clinical and social services, and we'll tell you a little bit more in depth about some of the programs and offerings we have at Out Youth in just a moment. Another thing that I'm involved in that you can kind of read about in my bio is the Central Texas Transgender Health Coalition, and that coalition is specifically geared towards providing training and education for mental health, but also medical professionals on providing quality gender affirming care. So presentations like this, I'm always honored to do them. They're right up my alley. Again, this is a population that's near and dear to my heart, and I'm just really happy to be here. And I'm really happy to be joined by my colleague, Summer, and I'm going to allow her to introduce herself.
Hi everyone, my name is Summer Hough. I use she, her pronouns, and I am a staff therapist at Out Youth. I've been there for, I'm working on my I'm working on my 3rd year. Also a population that's very near and dear to my heart. I started off as an intern at Out Youth actually, and so I didn't know that this was a population that was going to be so important to me. So just like me, you can learn, you can learn things. Yeah, I think that's good for now.
All right, fantastic. And as it mentions in Summer's bio, she wears several hats at Out Youth, as a lot of us do, working at a small nonprofit. And one of the programs that Summer is involved with at Out Youth is our school-based services program. And so I'll start with talking about BU. So BU is a research-formed, evidence-based curriculum that we've developed at our agency over the past several years to address minority stress among LGBTQIA youth, specifically in schools. And so that's a program that we're really proud of, that's been really innovative, and I encourage you to learn more. BU has its own website, so you can give that a Google and check it out if you're interested. So Out Youth serves specifically in that kind of part of our programming youth ages 12 to 18. So we'll really be sort of focusing on that population in this presentation today, although a lot of the concepts we're going to share will certainly apply to folks who, are transsexual minority folks throughout the lifespan, but we're going to focus specifically on adolescents in particular today. And then you see a few of our other programs. I already talked about Central Texas Transgender Health Coalition and our mission around education. We also have at Out Youth our Transgender Wellness program. We partner with the Kind Clinic, which is a sexual health and wellness clinic here in Austin, and we provide social support and counseling to transgender adults in that particular program. So that's just a little bit about us. And you can learn more about all of our programs and services at outyouth.org. I will say during this very interesting COVID-19 time, we have been able to offer our services virtually, which we've been really proud to be able to do that fairly seamlessly in most cases. But it's just been an interesting and challenging time in mental health for sure. So again, really appreciate you taking the time out to spend a little time with us today to learn about serving this particular population. And please feel free to ask questions throughout. And there are no dumb questions here today. I know it can be kind of intimidating to ask questions in this type of format, but we really encourage them. So with that, I'm going to have Summer introduce our objectives for our time together today.
Great. So we will define concepts related to gender identity and sexual orientation. Although we're not going to give definitions of all of the terms because this is a 101 and there's lots of terms, we'll give you a glossary so that you can refer to it later. During this presentation, we'll just be doing like a basic understanding of larger concepts so that you can apply it to the work you do. We will also be naming risk and protective factors for LGBTQIA+ youth. For example, we know that there's a lot of mental health disparities, there's depression in this population, but research shows there's also lots of resiliency in this population. So we'll talk a little bit about minority stress and see what the protective factors are as well. Thirdly, we will identify ways to reduce minority stress and improve mental health outcomes for the population. So we'll give you at least one concrete way to help people and give you a chance to practice it. Just like Sarah said, I really appreciate you being here on Zoom again, probably on Friday. It just really shows how invested you are in these kiddos, and we obviously really appreciate that. So we've got a case study. We'll be coming back to this case study throughout the presentation. I'll just read it for you and then we'll continue. So a 14-year-old youth who recently asked to be called Ronnie, not Veronica, discloses to you a desire to go by they pronouns. Ronnie wants to cut their hair short, but isn't sure how their parents will react, making them feel anxious. Ronnie's also stressed because while they've been dating Julie and came out as lesbian in 7th grade, they've started to have feelings for Ted, who identifies as male, and this is confusing for them. So I don't know about you, Sarah, but I see lots of Ronnies in my work. Yeah, I see lots of Ronnies.
So many Ronnies, absolutely. And I think also there is often some intersecting things that come up around both gender and sexuality and a lot of the young people that we work with and that we see for counseling services or group services. And I think sometimes if this isn't our primary population, it can feel a little overwhelming and a little bit confusing. And so in just a minute, Summer's going to talk to y'all about the differences between gender identity and sexual orientation and a couple of other baseline concepts that will hopefully simplify things just a little bit, at least in your mind as you're working with these youth. And the reason that is really important, and the reason we're seeing a lot of Ronnies, and probably y'all are maybe seeing some Ronnies as you move through the world in your clinical practice, is because there's just more kiddos like Ronnie out there right now. So this is a study, it's a couple years old at this point, but it looked at gender identity and sexual orientation in folks who identify as part of Gen Z. So at the time of this particular study, they were looking at 13 to 20-year-olds. And when they asked this population of Gen Z folks, 52% of them did not identify as exclusively heterosexual. So that means that they identified somewhere under the LGBT umbrella, And sometimes these days, especially young folks, have reclaimed the term queer, which we'll talk about. And so they identified somewhere under that umbrella when it came to their sexual orientation specifically. And also this study asked folks about friends and their peer group as it related to gender identity. And 56% of those youth knew somebody who used gender neutral pronouns. And so there's just a lot of folks out there who are really going through the dual task of kind of moving through adolescence, understanding their identity, and really thinking about their gender and sexuality in these ways. And so, again, you might be running into a fair amount of these folks in your clinical practice, which is why I'm glad you're here today to learn more of it. All right, so now Summer's going to take us through some of the basics of what we call the boxes.
So when I was growing up, I learned that all of these things were one entity and one really meant something. So I'm a girl. The doctor said I'm a girl. That means I'm attracted to boys. That means I present a certain way. And as I'm coming to learn more about gender and sexuality, I'm noticing that they're sort of different in a way that I didn't really know before. So that's why I like these boxes, because they really separate things in my mind. And then things can be a little bit less confusing. We've also gotten a lot of good feedback from parents that this is something that helps them understand things. So the top left is sex assigned at birth. I'm just going to give a quick overview of these boxes and then dive into a little bit more detail. So the top left is sex assigned at birth. It's what parts you were born with. Top right is your gender expression, which is how you show the world how you feel inside. Bottom left is your gender identity, what gender you identify with. And the bottom right is your sexual or romantic orientation, or who you're attracted to. So could you, oh, you did, thank you. So the top, I gotta make this bigger for my little eyes. So, okay, sex assigned at birth. When a baby is born, the doctor looks at that baby and says, this is a boy, or they say, this is a girl. As it turns out, sometimes a baby is born, sometimes a baby is born and the doctor says, I'm not so sure about this one. It doesn't clearly fit into either of the boxes. And those babies are called intersex. Intersex means, I got the definition somewhere. Sorry, y'all. I see. So there can be like I said, there can be ambiguous genitalia, like the doctor's just not exactly sure. There can be differences in level of hormones. I don't know if you heard, but there's a runner who technically was classified as intersex. And so they were talking about where she should be. There can also be discrepancies between external genitalia and internal reproductive organs. So somebody can have testes and also a uterus. So as it turns out, there's not just two boxes for gender. There can be a couple of differences. So yeah, sex assigned at birth. Sometimes people, the doctor says, this person is a girl, and then they grow up and they feel like a girl, and that person is what we would call cisgender. Sometimes the doctor can say, this is a girl, and when they grow up, they feel more like a boy, and that person will be called transgender. So another way somebody can be intersex is by looking at their chromosomes. So I've never had my chromosomes tested. The doctor told me I was a girl. I have grown up and I feel like a girl, so I would be considered cisgender, but I've never had my chromosomes tested. I could be intersex and just not know it. Mm-hmm. Sarah, I feel like I jumped around a little bit on that one. Do you have anything to add about sex assigned at birth?
I think you did an excellent job. And, I sort of joke sometimes in presentations that sex assigned at birth is, in a basic way, your bits and pieces in a general sense, but it also, gets down to this level of chromosomes, which I certainly didn't realize before I started doing this work. So Sex assigned at birth, we think really about kind of physiology and kind of the physical presentation of folks when we think about sex assigned at birth. And for some people, just like Summer mentioned, your sex assigned at birth may match your gender identity, which is who you really feel like you are. And for some people, it does not match. And so that's what we're going to talk about a little bit more throughout this presentation as well.
Mm-hmm. Yeah, so Sarah moved down to gender identity because, because sometimes we can feel female. So a gender identity is I'm male, I'm female, I'm genderqueer, gender non-binary. I can be so having some brain issues this morning. So like I mentioned, I was born, the doctor looked at me and said, you're a girl. And I grew up and I feel like a girl, so that makes me cisgender, makes me female. Some folks are assigned female at birth and grow up and feel male, and so they would be transgender. Then there's some people who feel like I don't really feel like I fit in those boxes of male or female. So I feel like I'm non-binary. I'm somewhere else or outside of these boxes. Some other words people use are genderqueer, queer. There's lots of words people have used, but the general concept is not inside one of these two boxes. Lots of people have questions about all these words, and quite frankly, you'd be coming up with new words all the time. So that's why, a quick Google search, whatever your client, if you're a therapist or if you're a parent, whatever your young person says to you, you can write it down and you can Google it later, or you can say, oh, that's so interesting. What does that mean to you? What does that look like in your life? And then, so separate from that, again, is your gender expression. So that's your external appearance. That's your external appearance, like your hairstyle, your clothing, your voice, your gestures. So sometimes people, I just want to add that. So like, this is my gender expression. Sometimes I don't feel like wearing earrings, or I don't put on makeup. Well, I never feel like putting on makeup, but sometimes I don't feel like wearing earrings. Sometimes I just want to wear basketball shorts. That doesn't really change my gender. That's just, how I'm presenting that day. There's lots of reasons that people would not present how they feel inside for other reasons, just besides comfort. Like sometimes it's not really safe to present as the gender you feel in your heart because the people around you aren't accepting, or you don't know if they'll be accepting. So that's why it's sort of hard to guess people's gender just by looking at them. Sometimes you just don't have enough clothes, have enough money to buy the clothes that you want to wear, or your hair hasn't grown out yet, and stuff like that. So gender expression and gender identity are separate. And then finally, also separate, is sexual orientation. So that's one's inherent, enduring emotional, romantic, or sexual attraction to other people. So we know gay and straight, maybe bisexual. Some other terms that you may not know are queer. Like Sarah said earlier, queer is a reclaimed term. So sometimes when I talk to older folks, I don't use the word queer because that was really thrown around as a slur. Seems like the younger generation is sort of reclaiming it. So maybe be cautious when you use that word. But if the young person is using it, feel free. And then there's also, queer is sort of an umbrella term. I have found it's something that can mean who knows what to young people. So that's why you can just ask, what does that mean to you? It's also sort of a umbrella term for LGBTQ folks, or anybody who's experiencing their gender or sexuality in a way that they don't feel like is straight or cisgender. There's also a word on here called asexual, which is when somebody's not interested in sex, doesn't have that drive to have sex. And then sort of like gender we're sort of figuring out is less like two boxes and more of like on a spectrum. Sexuality is the same way too. We have asexual people who are not really that interested in sex, and then I forgot the word for people who are sexual. Do you remember, Sarah?
Yeah, so there's folks who can identify as demisexual, and there's also a spectrum of aromantic. So there's some folks, for example, who may identify as aromantic, so they feel like romantic attraction, but they may occasionally decide, yes, I do want to have a relationship with sexual intimacy, and vice versa. There's some people who are demi-romantic or can have romantic attraction to other folks, but identify as asexual. So there's just a whole spectrum. Yep.
Yeah. So I just downloaded a lot of information to you, and I want you to know that you don't have to have any of this memorized. We'll give you some resources where you can look it all up again. And I think what's most important for us as humans interacting with other humans is to know that we don't have to do all this mental gymnastics. We don't have to know about people's bits and pieces. All that's important to me is knowing there's a human in front of me and they would like to be called this. And yeah, so in that way, it's good not to do mental gymnastics and think about they were assigned female at birth, but now they're presenting like this, you know, just to focus on the human in front of you. Mm-hmm. And yeah, yes. Mm-hmm.
Amazing. So I'm wondering now if we might want to pause for some questions. Mary, are there any questions that people have given us in the chat box that we might take a moment to respond to? If not, that's fine, but people feel free to ask some questions as we move through.
Yeah, there's none right now, but does anybody have any questions about kind of those 4 boxes that we went through? I know that like Summer and Sarah said, that's a lot of information.
There doesn't seem to be, but as they pop up, I can watch for them and let you know.
All right, fantastic. Well, feel free to interrupt me at any point, Summer or Mary. I'm just going to talk about kind of the next concept that we have, and it's around gender identity and sexuality exploration. So we just led you through the basics of gender and sexuality with the 4 boxes. And one thing we really just want to emphasize with LGBTQIA youth, or just youth in general, is that that exploration process is normal, and that gender and sexuality exist on a spectrum. And I think Summer did an excellent job explaining that as we went through the 4 boxes, and we talked about there's a spectrum even within asexuality. There is a spectrum within gender identity. It's not necessarily just as binary that has been imposed on us in terms of just male, just female. And in a little bit, we're going to have a video from some really amazing young people explaining that better than I ever could, certainly. All right, so if a young person is coming to you and they're doing some exploration around their gender identity and or their sexuality, doesn't necessarily mean anything at the moment. Doesn't mean that, you know, if we followed them for 5 years from now, that identity would remain static and the same. But it very well might mean that too. So we want to kind of hold that tension as we're speaking with people, and we want to just leave a lot of room and a lot of space clinically for that exploration with people. And we'll talk about that in a minute as we return to our case study. So bottom line is we really want to validate young people. I know as clinicians, which I think is the majority of folks on this particular presentation, we're really good at validating folks' feelings and what they're experiencing. And, you know, I think all the young clients that I've worked with have just really appreciated that validation. It's the same when we're talking about their sexuality and their gender identity. Really just validating them where they are is incredibly important, especially if they trust you enough to share this information with you and or to, you know, start that process of exploration with you or continue it. And we really want this to be youth-led. So as Summer mentioned before, sometimes I think we can get a little intimidated by all the terminology and all the new terms that are coming to fore when it comes to gender identity and sexual orientation. However, we want to be as informed as possible, but we also want to empower the youth to own their own experience and to explain to us what a certain term means to them potentially. So that's one example of how we can let the youth lead this process. I think at the other end of the spectrum, we also want to think about, obviously not wanting to force a youth to come out or to make assumptions based on like gender expression, for example. So we might encounter youth and just based on kind of cultural stereotypes, we might assume something about their sexuality or their gender identity and be like, why don't they just come out to me already? And fact is, we don't know that about where they're at with their gender identity or sexual orientation. So we want them to bring that to us. And I think that's just incredibly important. All right. So that's a little bit about that exploration process.
I think I'd like to add that.
Yes, please.
Yeah, self-exploration is really appropriate for young people. It's when they're sort of separating from their parents a little bit and trying to figure out who they are. So all this exploration is really developmentally appropriate. And yeah, some folks have the added task of exploring their gender identity or sexuality. So it's really, really developmentally appropriate for them to be doing all of this.
Yes, 100%. Okay, any questions popping up in the chat box that we want to address before we move back to Ronnie and our case study?
No questions.
No questions yet. Okay, sounds good. So now we're going to have a little bit of interaction with our client, Ronnie. So same scenario. We've got Ronnie who wants to use they pronouns, is really wanting to cut their hair short, but is worried about how the parents will react. And they're also doing some, questioning, but exploration and just thought processes around their sexuality. So how would we respond to Ronnie based upon what we've learned? And so I think what we'd like to do at this point is just we all chat some or type some things in the chat box just as a clinician with your level of knowledge right now, and maybe based on what we talked about with the 4 boxes and about gender and sexuality exploration, what would you do as a clinician? Generally speaking, how would you respond to Ronnie? And we want to give y'all a few minutes to share some ideas, and then Summer and I will have a discussion about this. So take a minute or two. All right, I can't quite see the chat box, so does somebody want to give me an update, or are folks sharing some ideas? Do folks need a little bit more time?
Well, Mary, I can only see.
Yeah, so I can see. So it's somebody said validate what they are feeling, validate that what they are feeling is normal and that it can be confusing. Tell Ronnie, help me understand, tell me more on how you identify yourself. I always explain sexuality as a rainbow or spectrum. There's no one size fits all. Love the person, not their parts.
Amazing.
Yeah.
Some great responses, y'all. Fantastic.
Mm-hmm.
Clarify or ask them to clarify their feelings about this.
Yeah, I love that idea. And going for the feelings piece of things, and, you know, validating what they're already expressing their feeling, but then also just, yeah, generally asking how they're feeling as they talk out all of these things with you is one thing I like to do with young people. Like, oh, how did it feel to just tell me all of this? Is one thing I tend to say a fair amount, and I'm hearing that a lot in those comments.
Yeah, get more of an understanding about these emotions is what somebody else also put.
Yeah, I really like how it seems like there's a theme of getting to know more. You and y'all are totally right, because you know a couple of details, and you need to know more, and Ronnie needs to know more too. Obviously, they're feeling confused.
Mm-hmm.
Somebody else just posted, discuss norms, and there is no clear definition of what is not normal or typical in terms of feelings. Everyone is different.
Mm-hmm. Yeah, I like that idea. I think that's something I also tend to do working with my clients, because I think there is a lot of fear and stigma and shame, and that's what we're about to talk about with minority stress, that even though there has been some growing acceptance in some of these areas over the last, let's say, decade or so, there's still a lot of internalized homophobia and transphobia that a lot of our clients deal with, even if they have fairly supportive environments. But certainly if they don't, within their family, let's say, they just absorbed these cultural messages about being abnormal, or this is not right, or this is not okay. So I think really sending that message that, you know, there's a range of normal, and you're falling within that, and I'm glad you're exploring that kind of thing. Yeah. Anything you would add to that, Summer?
Mm-hmm. And there's another. It says, express appreciation for feeling safe in sharing this with me. And I really love that. It normalizes exploration and builds your connection with the person. Yeah. Mm-hmm. I think sort of attached to what Sarah said is validating the anxiety that Ronnie might have because of all the norms in our society that they might feel like they're going against. So this could be confusing and fearful to ask their parents things, and even to talk to a clinician about it. So yeah. I think another important thing is to switch to calling this young person Ronnie and using they them pronouns, like right when they tell you, is also a good thing to do.
Mm-hmm. Yeah, talk about validating, and that's something we're gonna have y'all practice in just a little while here, so stay tuned for that. Something I'll mention at this point, as we have explored Ronnie, and if you've got some more ideas, though, feel free to keep typing them on in the chat. We can certainly look at those. It's just, this can be an overwhelming process, as several of y'all have mentioned, and as Summer mentioned, and validating that. And sometimes when clients are feeling that way, I like to do the old trick of saying, well, Ronnie, thank you for sharing all this with me. What would you like to focus on first? Just to kind of give them some direction and a place to start. Because I could guess as the clinician what is most distressing to them right now, but I might not be right. So that's another piece of this being youth-led, is really asking them, all right, Ronnie, what do you want to focus on first? Or what would be most helpful for us to dive into further today? Just to hopefully take away some of that overwhelm, but also have it be youth-directed. Okay, any other comments we want to process through, or anything else we want to say about Ronnie at this point? We're going to come back to Ronnie as well, and thank y'all for engaging with that.
Mm-hmm. Yeah, usually we do this live, and I'm looking at people's faces, so I really appreciate hearing from you.
100%. Okay, well, we're going to move on, but again, keep Ronnie in your minds. We're going to move back to them in just a little bit. So, Summer, do you want to do this quick note about vocabulary? I think we've talked about this a fair amount already, but just to kind of emphasize the point.
Yes. when I read that thing, the case study about Ronnie, again, it does, and then Sarah asked us what we should do. It brings up a little bit of anxiety for me, even because I don't want to make a mistake with my client. And it's so important to me to show that I am accepting and caring. And so, I just want to mention that it is sort of anxiety provoking, and you already, so knowing all the terms and knowing what to talk about next might not be as important as you think, because you already have what you need, and that is your appreciation for the person in front of you, your interest. You work with young people, or you work with people, or there's people in your life who you love, and so you have all the skills you need already. Plus you're here, so we know you're sort of getting an education about some of the things that you might not know. The bottom line is you don't really have to understand to be supportive. If you make a mistake, you can just correct yourself and move on. Or if they correct you, you can just say thanks and then just move right along. I think it doesn't have to feel awkward for anybody if you just keep it moving. It is good to know some of the terms that are sort of outdated. So we will share the GLAD media guide, so you can know some offensive terms that are, or maybe some ones that are outdated, so that you don't use those.
Yes, and I'll just piggyback on that. I think that's the biggest thing for me as I'm kind of interacting with other professionals in the mental health community is, just listening to your clients, being open-minded, and just not using terms that could be offensive or outdated versus like having to memorize an entire glossary of LGBT terms. I think is sort of the bottom line with that. And I think that it can feel intimidating, and I want to validate that as well, especially because new terms are coming up all the time. At the same time, I think if we're able to avoid some of those outdated terms and ask clients clarifying questions if we need to, that just builds our own comfort as clinicians working with somebody across cultures, because we may not share identities with the person we're working with. All right. Anything you want to add to that, Sarah, before we move forward?
I was just going to say, sometimes there are definitions that I know, and the young people think it means something else. So knowing the correct definition doesn't even help all the time. It's really best to know what they think it means.
Yes, excellent point. Absolutely. Okay. So again, don't have to understand to be supportive. So everybody can take a big sigh of relief with that statement, hopefully. Okay, so I'm going to jump into talking a little bit about minority stress, which is a phrase we've used a couple of times now. So I already mentioned a little bit that, there has been some good research that says public acceptance, at least, and some kind of legislation has signaled that there is growing acceptance of the LGBT community in some ways. However, it doesn't necessarily mean it's any easier. For some people who are in the process of exploring their gender or sexual orientation, or when they come out as LGBT, it may not be easier, depending on their particular context. We already talked about the concept of internalized homophobia or transphobia, which can really lead to some of these externalizing symptoms that we hear about a lot in the LGBT community, especially among youth. So higher rates of depression and anxiety in particular. A lot of you have probably seen some pretty startling statistics about suicidal ideation among this population. And I will say that, kind of across the lifespan in the youth and the adults that we serve at Out Youth, it's definitely a thing. There is a lot of a history of suicidal ideation among our population. And so, we want to make sure we can help clients address that minority stress as best we can as we're working with them as mental health professionals. So it is a particularly important concern, and why Summer and I love doing presentations like this, because, you know, we specialize in this population, certainly, at Outuse, and we're so happy and proud that we get to do that. However, we're never going to be able to meet the need, even in our Central Texas community. We currently have a 2 to 3 month waiting list for our services, our counseling services at Outuse. Part of that, I think, is because we offer them at low or no cost. But part of that, I think, is, you know, there's lots of therapists in the Austin area, but, you know, not all of them necessarily feel comfortable with the LGBT population, which, you know, ethically, we have to kind of work in our lane. At the same time, I think attending a presentation like this, doing a little bit of research, can definitely become a culturally competent and culturally responsive mental health professional, because we need you. We need as many people as we can caring about this particular population, because we do see the mental health effects that come from minority stress. Okay. Any questions, thoughts, feelings about any of that? Or Summer, would you like to add anything?
This study also talks a little bit about how young people are able to come out at a younger age. People are able to come out at a younger age than before, due to having more role models in society and being a little bit more acceptable. And also, if you work with middle schoolers, or if you know middle schoolers, they're at a particular age where they're really depending a lot on their friendship, and they're really trying to fit in with friends, and family becomes a little bit less important. They're spending all their time on their phones. So it also becomes a pretty judgmental time. And so people are particularly judgmental about other people and also about themselves. And so having anything that is perceived as different be a part of you is stressful, particularly for this fun developmental stage of exploring yourself.
Yes, thank you so much, Summer, for adding that. I think that's, really important to keep thinking about the fact that our youth are accomplishing these really difficult developmental tasks of adolescence while also exploring these things about their identity. And, you know, that just kind of compounds with one another sometimes, and, you know, can lead to some symptoms popping up. So I am aware of time. I do want to move through these protective factors relatively quickly, so we can get y'all to a video and some practice. So some of these are going to be fairly obvious to most of us. So we know that, you know, family, peer, community rejection is a factor, a risk factor for our young people. Certainly the school environment is also incredibly important, and can be a supportive environment or can be incredibly detrimental. And there's a lot of research on that. For example, the place of gender and sexuality alliances in schools, and even just having a club specifically for this population, how that really helps youth at the school, even if they don't participate in that particular club. So there's a lot of good research on that. And we've already talked about internalized homophobia and transphobia. I think it's incredibly important to mention, and, you know, apologies for not weaving into the presentation a little bit more, but certainly intersectional aspects of identity are going to complicate our risk factors. So if you're dealing with racism on top of transphobia, that is going to be a risk factor for you, because there's all of this societal stigma and judgment, not just based upon one or two aspects of your identity, but many aspects of your identity. So that's incredibly important to mention. And you see the protective factors there. And I think we can be, as mental health providers, part of that community of caring folks, in order to support our young people, to advocate for safe environments in schools, and to really provide youth with a sense of self-esteem and normalizing their experience of their identity. All right, Summer, you want to talk about another study from Dr. Russell?
Mm-hmm. Yeah, we're really lucky to have Dr. Stephen Russell. He's the chair of the Human Development and Family Sciences here at the University of Texas. He did a research study in 2018 with trans adolescents from age 15 to 21 from various ethnic backgrounds and located in 3 U.S. cities in the Northeast, the Southwest, and the West Coast. And this study found that for those who can use their chosen name and pronouns at work, at school, at home, and with friends, experienced their symptoms of severe depression went down by 71%. Their reported thoughts of suicide went down by 34%, and suicidal attempts went down by 65%. And that's compared to the youth who can't use their chosen names at those locations. So those numbers are sort of staggering to me as a mental health professional. Just doing this one thing can really help folks' mental health. Dr. Russell said that the more context and settings where they're able to use their preferred name and pronouns, sort of the stronger their mental health is. He said he's been doing research for 20 years and he's really surprised how clear it was. And it's always a popular topic in my sessions. I say, okay, do your parents use your pronouns? Do your friends? Are you out at work? And that's really important to people.
Mm-hmm.
So I like to sort of start with the research and the numbers so that you can see really how important it is. And now I'd like to bring it back to the kiddos, which is what we actually care about. And so we can hear it from their mouths. So you can play that, Sarah.
All right. We won't encounter an ad if we will try and skip it as quickly as possible.
Just because I present more them doesn't mean that I'm they them.
You know what, that you're eating a meal, but you're not really eating a meal, you're just kind of picking your food on the counter. My family and I were doing that way, and I just got says, guys, I'm non-binary. I don't have a gender.
In my opinion, gender is a universe. It is a broad spectrum of planets and stars and sky. It really cannot be contained into
my pronouns are they, them, theirs, and that's negotiable. They're all kind of like, okay. I think one of the main reasons pronouns are so important is because other than our name, it's one of the main ways that people identify and call us.
My pronouns are personally very important to me. Growing up, enculturated into kind of a system that really subscribes to toxic masculinity, I was always uncomfortable with being called dude, what's up, man. I was so bad at that.
Sarah?
Like that.
The video was a little bit choppy. Do you think we could stop it and let it load a little bit and then restart?
Yeah, I just see too much internet for my particular system and computer to handle. So we'll give it one more try, and if it's still not working so well and frustrating, we can just stop it. So Summer, can you know that?
Yes.
Okay. Pronouns, essentially taking their little piece of that broad universe and identifying with that. And so in using their correct pronouns, we're validating that yes, you are right to your identity and you are important and we're respecting.
Yeah, Sarah, it seems like it's still really choppy and not really working. Is there a way that we can maybe just share the link that our participants can be able to watch it at a different time?
Yes, absolutely. And it might be playing a little bit different on y'all's end than it is on my computer, so apologies. It's a 4-minute video. It's really breezes by, and these young people are just so incredible and amazing. Summer, is there anything you want to highlight from the video that we didn't get to see that you think is really important to mention briefly?
Yes, I think I really like this video because it sort of shows how young people are thinking about gender now, and they've helped me to see it in a different way. Somebody says that gender is like a galaxy, and they get to pick their own particular spot. So instead of it being my gender is male or my gender is female, they get to pick their spot from where they want, from what they feel like is in their heart. And that's how they can express themselves and how they feel, and they can be sort of true to themselves in that way instead of trying to fit themselves into one of these boxes. And then just how important it is to understand that they are not in this box, and then ignoring that is sort of ignoring their identity. And identity is a really important part of us as humans.
Mm-hmm. Yeah, and the only other thing I'll mention from the video that always stands out to me is one of the young people quotes Laverne Cox, who is a famous transgender woman and activist, who said that misgendering a trans person is an act of violence. And that just kind of hits me every time, and just as a friendly reminder that this is just incredibly important for the gender diverse people that we work with. I will just reiterate something Summer said earlier, though, as I say that, is that sometimes we make mistakes. I do this day in and day out, and sometimes when a youth asserts a new pronoun, I make mistakes sometimes, and what I try to do is just own that mistake, say I'm sorry, and move on. Just to acknowledge that, my bad, like I really, apologize for that, but not making it about me, but just expressing to the young person my apologies for making that mistake. And I know in particular that sometimes gender neutral pronouns can take a minute for people to get used to. I know that just can be a struggle. So that's why we wanted to have people practice these pronouns in particular. And so I think given our time constraints and just the format of this, we might just have Summer and myself demonstrate this, but I would encourage you to try and follow along and practice using these gender neutral pronouns. So Summer, do you want to take part A about Ronnie, and I can take part B?
Yeah. So have you seen Ronnie since yesterday? I saw them at the hair salon, but I left before I could see their new haircut.
Yeah, I just saw Ronnie this morning. Their hair looks great. So good news, everybody. Ronnie's parents allowed them to get that haircut. So that's pretty cool. And it's looking good. So, I mean, this is obviously pre-stay-at-home order. So just to be clear about that. But good news, Ronnie was able to get that haircut. And you see how we were just able to, use Ronnie's name and their gender neutral pronouns in that exchange. The other thing I would mention is with pronouns, practicing even if that person isn't in your presence is really important. So not reverting to a different pronoun that's not the one they use when you're talking about them with another clinician, let's say, when you're staffing a case, always using that pronoun consistently is really, really important. Okay. So in our last couple minutes, I want to make sure to leave a minute or two for questions, but here's some resources, and I want to assure you that if we're sending a link to the video, again, apologies for that, we can also send these resources to Mary, and she can share them with y'all via email if that works. But Summer, do you want to highlight a couple of these resources as we close?
Yes, this page has the GLAAD media guide on it. And that's the one that I referenced that has the outdated terms. So you can check those out. My personal favorite resource is The Transgender Child by Stephanie Brill and Rachel Pepper. And that one sort of taught me everything I knew, everything I know when I started. It was super helpful. It's for parents, professionals, teachers, counselors. It's for everyone. You can also watch some reputable YouTubers like Uppercase Chase or Tea Time with the T-Boys, or there's some podcasts like How to Be a Girl and Query if you're doing like me and listening to lots of stuff these days. On the next page we have Lambda Legal, which is a legal resource for parents and teachers if you're dealing with schools or anything, and GLSEN, which is for education. Specifically, I think, to create safe and affirming schools. And here we have online support for parents. So the Gender Spectrum website is very educational for parents who are learning this stuff. And there's a online support group and it's also available in Spanish. There's also the Family Acceptance Project and the Strong Family Alliance for sort of more conservative families.
All right, so Mary, back to you. If you have any housekeeping announcements, or if we received any more comments or questions in the chat, we'd be happy to answer those now.
Awesome. Well, we'll keep the chat box open for a few minutes, but I just want to say thank you so much, Summer and Sarah. That was very informative. Hopefully you all got something out of that, and at least a few takeaways to be able to start in your practice. I know I certainly did. For those of you that don't know about SonderMind, we are a mental health organization that supports therapists to thrive in their private practice by taking care of administrative areas such as credentialing, billing, and marketing, while simultaneously supporting clients that are seeking care to get matched with a therapist best for them. We are currently in Colorado, Texas, as well as Arizona, and we're quickly expanding our telehealth services. So there's a lot of exciting things to happen with SonderMind. The contact information that is up is your community liaisons in each of these communities. If you don't see your specific community on there, please feel free to reach out to any of us and we can help get you connected. We also want to invite you to our next week's episode, which will be on May 7th, where Ragan will be discussing how we've all fallen prey at one time or another to obsessively questioning what others think about us and how we can help control it. And he's also another Austin native, and so we're excited to have somebody else from Austin join us. But we'll keep the line open for a little bit and see if anybody has any other questions. But again, thank you so much, Sarah and Summer, and for all of our participants for joining us on a Friday afternoon.
Yes, thank you all so much, and thanks for everything you're doing in your communities, just to promote mental health and be providers, especially during this time, no matter what population you work. I think this is just an incredibly vital time for our profession to be supportive, and so just really appreciate, again, people taking time out today.